welcome to another episode of Smiles in the Air, your oral health and prevention podcast. Today with me we have an amazing clinicians from Turkey. Let's say Turkey because it's their new name and it's easier to understand. So I will mess the names. I already said this because I'm not a Turkish talking guy, but we have a Gökçe with us from Ankara. She's now doing her PhD
Yes,
in the periodontology in Gazi University, and we have Nejla, Oral and Maxillofacial Surgeon from Istanbul, Turkey, and also the founder of the Swiss Istanbul Dental Clinic.
Yes,
right?
yes,
So
that's right.
I will ask some questions about the name for sure because there's Swiss inside in Turkey, so I will have these questions. So welcome to the podcast.
Thank you for having us.
No,
Thank you.
It's a pleasure. So you can be comfortable. We can talk easily here. We were talking in the before talking. There's a family tradition.
Yes, exactly. My father is also a periodontologist, so he's always been my role model, and he's always in the preventive side of periodontology. He does surgery, but he keeps it like more precious, the preventive treatment. So that's why it's kind of like my role model, and the idea of periodontology comes from there.
So you were already born in the preventive practice.
Yes, exactly. Yes.
So how was it? Because you are coming from the university, you have all these ideas to implement, and then you get to your family practice.
The only specialty that attracted me while I was studying in university was definitely periodontology, because I wanted to be in the preventive area and in the surgical area. So my father, of course, he led me to this area as a lecturer in this area almost like 30 years. I've seen everything from him, how to manage patients, how to care for my patients. And I got all the ethical approach from him. Yeah, that's it basically.
So, and from tradition, we pass to a new clinic because you co-founded this Swiss Istanbul.
Yes.
Swiss Istanbul.
Istanbul. Yes.
Dental clinic. Why Swiss on it?
Why Swiss? Because my mom is from Switzerland and my dad is Turkish, and I was born in Switzerland. Then I moved to Turkey. I studied in Istanbul dentistry, and I did my master's in Istanbul. And then I decided to open our clinic. And actually, I had a really hard time finding the name. I didn't study it so much for my son's names as as I was thinking about the name of our clinic. But at the end, I think we found a good one. We have also patients from Switzerland, a lot of patients, because we integrated in our daily practice a personal care, a personal patient care, and we are not doing like health tourism. We are not working fast. We are really working slow and precise, and that's actually one of the reasons we integrated GBT in our practice too. And since 2021, we have integrated GBT in our practice, and our patients are really happy with the results, and me too, of course.
It's funny because we have a new clinic and you have a legacy clinic, but you are here gathering in the same area, that is prevention.
Yes.
So why, and this now is a question for both of you, why in this new practice we started by having the prevention as the core, and why in the legacy practice? Because it's easier to understand because you already have a patient book, so you need to maintain the patient book. So why you have also the prevention and the core? I think it's gonna be maybe different answers, but or the same. I don't know. So who wants to start?
I can answer this from my perspective of periodontology, because the best way to treat periodontal diseases, actually peri-implant diseases, is to prevent it in the first place. So that's why the legacy clinic also supports preventive therapies, because it's always so much difficult to treat what's already been disturbed. So the key is preventing the disease and maintaining the health, keeping everything healthy. With so what I'm trying to mean is that surgery or advanced surgeries are always more difficult and has more risks for failure. That's why prevention is such a more easier way to keep everything going.
Ethical also.
Yeah,
Yes.
ethical.
Yes. From my perspective, we are doing a lot of implant operations. We don't. If the patient has no tooth anymore, we have to put something on the place to make him chew again, make him smile again. And when we do this work, when we do the implant operation, we give the patient a new chance, a new tooth. But it's not just about giving it, it's actually about maintaining it. Nowadays, we are not just talking about survival rates of implants, we are talking about success. And success is coming through a healthy tissue, a healthy soft tissue, a healthy bone, and a healthy oral health, and a healthy patient. Now, actually, holistic dentistry is very popular and demanding. And the only way to maintain the oral health is to educate the patients and keeping them making. Okay, maybe we can cut this part. Sorry.
No worries. You can continue.
Okay, the only way to keep the oral health is to motivate patients and making them clean their teeth good and motivating for oral hygiene. That's actually why we give so much effort on prevention in a new clinic.
Having a good planning and having a good support tissue is already half the way for having a successful rate of the implants.
Yes.
The truth is, like you talked before getting to the podcast about periimplantitis, because it still exists.
Yes, unfortunately.
So how are you managing these cases?
Actually, if it's at an early stage, if it's mucositis, most of the cases we are managing with GBT. And if it's on a bad stage, then we integrate GBT again. We start always with GBT, and we start to reduce the how can I explain it? We try to reduce the illness. We try to reduce it to the minimum, and afterwards we are doing the surgical treatment.
Try to stabilize before moving to the surgery.
Yes, exactly. That's what we do, because diving directly into surgery is too much aggressive nowadays. We don't do it anymore. We try to minimize it, and then.
I agree. You talked before in one topic was the health tourism, or we know as dental tourism, and I already know the comments on this podcast as Turkey, dental tourism.
Yes.
But the thing is, there's different practice, there are different ways of perceiving, and here we have two high-end practice. How you perceive this, that's the first point. The second one, you said that you need to have a good tissue before placing the implant, but if you are taking these tourists for dental health, they want everything today.
Yes.
So how are you going to establish and how you have a good success rate? So how you are managing it, because the thing is, like, it's not right to place every clinician in Turkey as dental tourists clinicians, and you get this label, unfortunately. So how you manage this?
Actually, at the beginning I said we are not doing health tourism. Yes, that's true. But of course we have foreign patients. We have patients from all over the world. We do an online consultation before they come, and we always tell them to put minimum 2 weeks in their schedule, that we can first start with the implants or with the oral health, or do an examination first. And we always give them the exact times they have to stay. We are not like saying we are doing everything in 5 days, 3 days. That's very important to inform the patients before they come, and that they can know how long they have to stay, and that they have to come again after a period of time. And of course, we love to see them for checkups every 6 months or at least every year, or we tell them to go to another practice in their country to do checkups or to do oral hygiene, to do GBT. We lead them to other GBT clinics in their countries. And I think the most important thing is to inform the patients and to give them good answers to their expectations at the beginning, and not to, how can I describe it? Okay, maybe we'll cut this part. Okay. Sorry. Maybe Gökçe has to add something.
I can add something. Our clinic does not provide health tourism, but for patients, some patients come to our clinic like, I want this, like a whole denture, whole implant surgeries done and completed in 1 week. And we always tell them that we can't fasten your biology, human biology. There are facts. If you need augmentation, we're gonna wait like 6 months, 4 months. You have to follow our schedule. You're not gonna follow your schedule. So that's like a deal with the patient before the treatment starts. So it's really important to be on the same ground with the patient, on the same page with the patient. For we don't have much we have foreigner patients, but most of our patient profile is locals.
Local patients. Yeah.
Local patients.
That's why also your father focused also in prevention, because
Exactly.
you have done all the work and now he wants the work to stay at the right place.
Yes, we're not greedy. Some people are not ethical and become greedy and do more implants, earn more money. But I always do, and because my father always taught me this, if approach your patient like that is you on the dental unit. And I always think if I was here, would I be willing to do this to myself? So this is both for sterilization and cleaning and the effectiveness of the devices that we use. So that's why I try to inform all my patients about biofilm, bacteria, and the importance of bacteria. Sometimes people cannot understand the importance of oral health or bleeding gums, how this situation can cause so many systemic diseases. So in the first place, I always underline these to my patients and tell them a detailed plan of the GBT protocol and how it affects their whole health, including their heart diseases, like their metabolism, and even their brain. I always tell them.
That's important. Basically, if what you said is planning is the most important thing, and also being transparent with the patients, having the good communication, and establish already a plan where prevention is included, because you know that if they lost a tooth, there was a reason for it, and this reason can be periodontitis. If you put an implant, probably you're gonna speed up the process, and we will end with periodontitis, and when we notice, it's already too late, and you have the implant in your hand. So this is super important. But another thing that I noticed, or that we had talks and with Begum, one colleague from Turkey, we had these discussions, is that you are trying to change the dogma also in Turkey. Because
Yes.
you are trying to change the mentality.
Yes.
Not only from the patients that you have, but from clinicians, colleagues. How is it?
It's actually easy and hard, both of it, because we have a lot of young dentists and willing to learn new things, willing to improve themselves. We have a lot of colleagues, and I think it's very fun to engage with them, and I really like to interact with them and learn new things from them. Actually, I go for SDA courses to teach them, but in every practice you learn new things and you can benefit from them, and of course they benefit from you. But lot of dentists are very open-minded, I must say, and they want to integrate new technologies, new approaches in their practice. And I'm really having fun doing the STA courses. I really like it.
Good to know. Good
Yes.
to hear.
I also do STA courses, especially in my hometown, Ankara. So young dentists are more willing to learn the GBT protocol because the older ones are like, I've been doing conventional for my whole life. What's the difference? That you cannot persuade them because they don't want to believe the new stuff. They don't want to commit to the scientific facts. So during these courses, it's always fun and because you're engaging with new dentists, fresh graduated people, old ones, but open-minded old ones.
The old ones will be angry with us. No, they are very open-minded old ones.
Yeah, and it's always fun to networking with them.
But I was in a congress in Rome, and where they have some statistics, and it was funny because population that was more willing to change was dental hygienists, and it was the younger group. Mm-hmm. And the population on oral clinicians we're talking that was less willing to change was dentists, and they were getting with the more advanced age on the group. So it's meaning that universities, they are creating more dental hygienists because they are creating for the future of the prevention than dentists. Mm-hmm. So today we have a lack of dental hygienists, and in the future going to be the other way around. And what happens is because these practitioners, they have a more advanced age, they are not willing to invest on their practice because everything that they have done for the next 30, 40 years, it was working in their terms. So why to change? Because changing implies to invest some of your time to training, invest also in terms of new technologies, and explain to the patients that they are changing methods that they always explain that they were the correct ones. So we need to take these three things into us because we are trying to change mentality here, the mindset, and also understand that this will take time. I think we are in the good way. And to be honest with you, I think Turkey is better than Europe in this case, because Europe is the old continent, as people call it. And old continent means that it's been years that we are doing the same thing and thinking that it is working. We see some shifting, what is good, but interesting is, and I'm maybe following a little bit more Turkey since last year, and since last year, it was just like an arrow. People are willing to adopt, they want to be trained, they want to know more about GBT, for example, what GBT can bring to them, how they can apply this, what is the interest for the patients, not the interest for the clinicians.
Yes.
But it's funny, the interest for the patients. So they are changing the experience, and not what I want, but what the patient needs. And this is cool. Do you feel the same thing there?
Yes, definitely. I feel the same thing. And it's coming. Actually, if you integrate it into the practice, it's an investment, but it's coming with its pluses. But the dentists are, as you told, putting the patient's needs on the first list, actually, on the top of the list, and they are happy with the no pain technology, with the comfortable side of the GBT treatment, and that's actually the number one cause they are integrated into the practice.
So we are seeing a good shift.
Yes.
Right. So hope that every practice is going to be like your practice and the practice of your father, a legacy one putting prevention, and your that is already starting with a good core value.
Yes.
And if we have that, for sure, patients will follow us. Because if we have the right values, patients will follow us.
Exactly. Some patients, sometimes the patients ask me if I'm doing the GBT protocol or using airflowing, and when I hear this from the public, it gives me hope that the mindset is changing. As you said, rather than the clinicians, the people, the patients are asking and demanding this. So it's so nice to see the change.
we are in a place, we are in a place that we are handling patients that they are the best well-informed patients ever. If we think about the era of our parents or grandparents, like where they will have access to this kind of information. Today, they Google it and they will find 1,000 things. So we as clinicians, we don't need to explain anymore. What we need is to choose the right information for them. And this is the problem, because they go to Google, they want to have a dental clinic, and they end with a cancer diagnosis, right?
Yes.
Because they cannot define what is good and adapted to them and what is not. So today, for us, it's not only explain, is to make the separation between bad information or not adapted to you and good information and adapted to you.
Yes.
So having patients saying airflowing, yeah, that's okay. Yeah, that's the other level for sure.
But more and more patients are really asking if we are doing air flowing. Yes.
Really, that's
Yes.
good to know. See, Turkey is on the front run.
Yes, definitely.
Good. Any advice for colleagues that are hearing you for the first time or the second time?
For my young colleagues, I can say that believe in the effect of biofilm and believe in the process of managing biofilm, since everything starts with this in oral health. Not just in oral health, but the whole health as a body.
Yeah, general health. Yeah,
General
for sure.
health.
I would say it's very important to stay on the news technology, to follow the news technology, and always to research and doing research in an academic way. Because as you told, there is a lot of information everywhere, and there is a pollution of information actually. And it's very important to get to the right source of information.
Completely agree. So thank you so much for being here. It was really a pleasure.
Thank you very
Finally, we have
much.
some Turkish people on this podcast. We were missing this. So it was a pleasure. For our listeners, so you hear it here, communication, it is important. Plan everything with your patients. Make sure that you are putting the prevention in front of everything. And do not forget, Turkey is not dental tourism. We have here an example of clinicians that are trying to shift this mentality and remove this label. But I completely agree. So thank you so much, and do not forget to subscribe in every platform that you are listening to this podcast. It can be Apple Podcasts, Spotify, and YouTube. And do not miss the next episode. Thank you. Good.